Hi everyone, my name is Tara.
My name is Carmen.
And we are physiotherapists here at Pulse Physiotherapy. And today we're going to show you a few of our favorite exercises that we do with our clients here on this piece of equipment, which is called the reformer. So you'll see that in our videos. But then we also want to include an at-home version. So a way that you could do these exact same exercises at home with very little equipment.
So we're first going to show you the chest expansion, which is a really good exercise that we do with a lot of our shoulder patients, anyone with any shoulder instability or injuries. It's also very good for anyone who's working on their posture, who's sitting a lot in their day and they find themselves rounding their shoulders a lot. This exercise focuses on setting your shoulder blade into a good position, helps stabilizes it while you engage your core and include some arm movements into it. Okay, so now I'll show you the exercise. So I'll give Tara these ropes here. Oh. So for this, we want to be nice and tall, looking forward. We want to roll our shoulder blades back, but just let it sit nicely on top of our rib cage. We're not trying to grip into our neck or our upper traps here. So I'll have Tara just look side to side for me and rotate her head. How does that feel? Good. Good. Excellent. Okay. And now she's going to slightly engage her core muscles so she doesn't move around too much. And then you're going to keep your elbow straight and then pull back. We're going to stop right at the torso here. We're going to hold. And to make sure that we're not gripping into our neck muscles even more or any of our upper trap muscles, I'm just going to have her turn side to side again. And how does that feel, Tara? Excellent. Yeah. Okay, and then you're going to relax for me. Okay, let's try it again. So we're going to make sure the shoulder blade is in a good position. And then we're going to pull. Good, and hold. Check that neck. So because you guys don't have a reformer at home, we'll show you this exercise as a home exercise that you can do daily. So same thing, we're going to be in the same kneeling position. You're going to wrap a band around stair railing or tie a knot and tuck it between your door. And make sure the door is closed at home. Okay? And now, same thing, Tara's going to look forward. I'm going to have her set her shoulder blade back by herself. Good. Should be nice and relaxed. So again, check your shoulder blade first. So turn your neck side to side. You shouldn't feel any tension. Okay? Engage the core slightly. And then we're going to pull back. And hold. Again, check your neck. Good. And how's that feel, Tara? Good. Excellent. And then we're going to relax. Excellent. And again. Perfect.
Okay, so this is one of our favorite exercises for what we would call lumbo-pelvic stability. So stability through your glutes, through your hip stabilizers, through your deep core, and through your low back. So super important for really everyone, but you know, runners, any kind of jumping sport, any sports where you're changing direction. And then of course we see this a lot in our older population as well, where they start to have back pain or hip pain. So we'll show you the version that we like to do while you're here with us on the reformer, and then we'll show you the at-home version. So Carmen, go ahead and push yourself out on the reformer there. Perfect. Now she's going to keep her pelvis nice and neutral. So there's a little window for a ladybug, I like to say, under her low back. And then in this position, she's going to exhale to lift one knee, just like you're marching. Good, and inhale to put it down. Good, and exhale other leg. So she's doing a really good job of staying very stable through her pelvis here. And that's what we want. So lots of attention on the transfer of weight right here. Nothing's too shifty. Imagine there's that cup of hot tea on your belly button and you're not letting it spill. So very, very smooth. Nice job. Good. One more. Inhale. Good. And then go ahead, bend your knees and come on in. And now we'll show you the at-home version. Okay, so this is your at-home version of our lumbo-pelvic stability exercise that we just showed you on the reformer. So you do need a ball for this one, although you could also modify it and use a foam roller. So the foam roller would go horizontally across the wall, and you would need to be a little closer to the wall to use it, just so that you can have your feet on the foam roller against the wall. So Carmen's laying here on her back. We're gonna get the ball to go between the wall and her feet, but off the ground. So you see there's that space underneath the ball. She's stabilizing it there. This is nice and tricky. You gotta gauge your distance from the wall. Now, same thing. She's gonna have a little ladybug window under her back. So she's in her neutral pelvis. She's just gonna exhale to lift one knee. Very good. Inhale, put it down. Now her left leg's her standing leg. Exhale, lift the right. Inhale, place it down. Exhale, lift the left. And she's doing a really good job. You want to minimize the movement of the ball with this one. Super hard. If this feels too challenging, you could do a version where the ball is on the wall. So she might need to scoot back just a little bit. You could do that same weight transfer, or sorry, the ball is on the floor. I don't think I said that right. The ball is on the floor, and then she's doing her weight transfer here. So lifting one knee, exhale, lift, inhale, lower. So this still offers that sort of side to side instability, but obviously not any up or down instability because the ball's resting on the floor. Very good.
Thank you so much for watching our video. We hope you found it informative and that you get to try these exercises at home. At Pulse Physiotherapy, we offer physiotherapy, clinical Pilates, pelvic floor physiotherapy, massage therapy, and acupuncture. From all of us at Pulse Physiotherapy, we wish you the very best with your Transform Challenge. Please don't hesitate to reach out to us if you need any assistance with injury prevention or recovery. We want to help you reach your goals and feel your absolute best.